it usually starts with 911 high utilizers, individuals in the community who are looking for help through the 911 system. They don't know where else to look, so they call 911. We said, let's address some of those socioeconomic needs. We connected that individual with community, and we saw a 70% reduction in 911 use within 3 months of our highest utilizers. The Tulsa Fire Department, we have 30 fire stations, 734 firefighters. We're a mix of BLS and ALS. We're dedicated to the protection of life, health, property, and environment, and we're doing that through mobile response and community healthcare. We've taken a systems approach to improving healthcare delivery by aligning our data through community-specific risk teams and partnering with the different agencies within our city to really improve healthcare delivery or out-of-hospital care for the individual. We turn data into action, and I think data is incredibly important. So we use it for EPCR reporting, we use it for fire reporting, we use it for inspections, we use it for quality, we use insights. The conversations that I have with city officials, with hospitals, the data, you've got to have that as a baseline for your conversation. And so we've utilized data to improve our programs, to add these alternate response units. When you look at mobile integrated healthcare, a lot of agencies across the nation, it usually starts with 911 high utilizers, individuals in the community who are looking for help through the 911 system. They don't know where else to look, so they call 911. We said, let's address some of those socioeconomic needs. We saw a 70% reduction in 911 use within 3 months of our highest utilizers. Our foundational program is called TFD CARES, which stands for Community Assistance, Referrals, and Educational Services. So we get referrals from hospitals, we get them from ambulance service, law enforcement, behavioral health. And when we get those referrals, we'll send case managers or community paramedics to the house, and they'll do what we call a psychosocial assessment and develop plans. And so they'll determine, what is this individual dealing with today? And usually it's a number of factors, it's not just one. What we're really good at is developing those plans and connecting those individuals to medical and social services. So we want to make their home safer, their environment safer. So we also, hey, do you have trip hazards? Do you have bad lighting? Do you have fire hazards in your home, which we help quite a bit and educate. Health literacy, we try to address those things through home safety assessments and also medical evaluations. So when you look at our total department, we make right around 80,000 calls a year. About 60,000 of those are EMS. And our MIH teams, last year, they made a little over 5,000 interactions or encounters. So when you look at high utilizers that we have within our program, we have right around 100. We're very proud to say we complete those services within about 2 weeks, 52% of the time. So a lot of the time, we're able to apply very quick results, whether it's grab bars, wheelchair ramps, connection to services, food, or transportation within 2 weeks. And that individual stops calling 911, they stop going to the emergency department as much, and they have better overall health. My word of the year for my EMS office was automation. And where can we find ways to utilize technology to our advantage to improve processes? ESO has been critical to that for us in doing that with our department. Mobile integrated healthcare should be specific to your community and the needs that you're dealing with. But if our community risks change tomorrow, our units can be flexible to change to that. Software and technology like ESO allow us to have that informed decision making and that data to make those improvements in the system.